Good, thank you.
My name is Jeanne. I'm a family nurse practitioner student at NIU, and I'm here to perform your physical assessment. Is that okay with you?
That's okay.
Very good. First, I'm going to wash my hand. I'm going to ask you a few questions. Can you tell me your name?
My name is Daisy.
What is your date of birth?
June 24, 86.
Can you tell me the month and the year?
This is August 2021.
Okay. Do you know who is the President of the United States?
Yes, Joe Biden.
Okay, I'm going to tell you 3 words and I want you to remember because I'm going to ask you at some point during the exam. That is table, chair, and spoon. Okay, so we're going to go on. I'm going to take your first question. Are you okay?
Yes.
Very good. Now 20 to 60. I'm going to take your pulse and respiration. Just relax, okay? Very good. Your pulse is 68 and your respiration is 18. Now, can you tell me the 3 words that I told you earlier?
Table, chair, and spoon.
Okay. Are you able to count backward from 10 to 1?
Yes.
Okay. Can you do that for me?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay. Patient is alert and oriented to time, place, situation. And also patient is coherent in her speech. And she also have good memory and able to count backward. Okay, so now I'm going to go and examine your skin. There are no sign of no marks, no bumps on your skin, and your skin is warm, and the color is normal for ethnicity, and the skin turgor is also good. Okay, I will be examining your scalp. This patient has a wig, but the front of the scalp show that the hair is coarse and well distributed, no sign of lice or hair loss. Okay, I'm going to also examine your scalp. Is that okay?
Yeah.
Just get comfortable and tell me if you feel any tenderness.
No tenderness.
No tenderness. Okay, everything is good with tenderness. All right. You can open your eyes and relax, okay? I'm going to perform a series of tests to check your eyes, okay? And what I will do is I'm gonna use this light. Okay, I'm gonna check your consensual vision. You can just look at me, and I'm gonna wind the light and observe the other pupil, and it's constrict, constrict. I'm gonna do the same for the other one, constrict, and I'm gonna do direct light. Okay. Now, what I want you to do, I also want you to look at my finger and look far away. Look at my finger again. Look far away. Okay. I'm going to do also your peripheral vision. I'm just going to move my hand and tell me when you see my hand, okay?
No. No. No.
Okay. I'm going to give you this chart and I'm going to ask you to read this line for me. I want you to cover your left eyes, your right eyes, whichever one is easier for you. Can you read this for me?
LTFPH.
Okay. Keep it covered. Can you tell me what color is this?
Red.
And what color is that?
Green.
Okay, I want you to cover the other one. Can you read this line for me again?
LTFPH.
Can you tell me this color?
Green.
Can you tell me this color?
Red.
Okay. Optic nerve, cranial nerve number 2 is intact for visual acuity. Patient was able to see and read, to see my hands, performing the peripheral vision, and also read, understand, and chart. Okay? So now I want you to look at my finger and look at the movement of my finger only with your eyes without turning your head, okay? I tested cranial nerve number 3, 4, and 6. Patient is able to watch my finger performing the cardinal sign. Cranial nerve 3, 4, and 6 are also intact. Okay? Very good. All right. We're going to go on. Okay, we're going to finish with the eyes. I'm going to put the light to check the red reflex. Red reflex is present. Red reflex is present. I'm going to get a little bit closer to you so I can look at the back of your eyes, okay? I'm just going to touch your forehead, okay? And I'm going to get a little bit closer to you. Okay. There are no sign of hemorrhage or ratio disc and cup proportion is proportional. I'm going to check your other one. Okay, so yeah, relax, just look at me, just look at the light. Okay. All right, no sign of bleeding or hemorrhage, and cup to disc ratio is also proportional. Okay, very good. Now, in performing the exam also, I was able to see that the sclera is white and the conjunctiva is pink. While I'm at the eyes, I'm going to palpate the lacrimal gland, and no sign of tearing or exudate from the eyes. So, now, what I will ask you to do next, I want you to cover one nostril and breathe. I want you to do the same with the other one. Breathe. Okay, very good. Now, I want you to close your eyes and I want you to cover one nostril, and I want you to smell this for me.
Coffee.
Do the same with the other one.
Coffee.
Okay, I was able to check cranial nerve number 1, which is olfactory, is also intact in patient. Now, I'm going to go to the back and I'm going to whisper something and you're going to tell me what you hear. And that will be testing cranial nerve number 8, which is the acoustic nerve. Okay?
$99. 1, 2, 3.
Okay. Cranial nerve number 8 is also intact. Patient was able to repeat what I whispered to both of her ears. Okay? And then now I'm going to perform what we call a water test. I'm going to tap on this and you're going to tell me if you feel the vibration in both ears equal. Okay?
I hear the vibration in both ears equally.
Okay, very good. And now I'm going to do the Winnie test. Before I do the test, actually, let me just inspect your ears. Do you feel any tenderness, any pain?
No.
So the ear look in the proper position and no tenderness, no itching, no black mark, no lesion noted. Okay, so I'm going to perform the test by tapping, putting on the mystoid bone. Tell me when it diminishes.
No.
And then tell me when you can no longer hear it.
No.
Okay. Air conduction is superior to bone conduction, about 2 times air conduction to bone conduction. Okay, I'm going to do the same. Tap it. Put on the mystoid bone. Tell me when it diminishes.
No.
Okay.
No.
Again, air conduction in the right ear is also superior to bone conduction. Okay. Now I'm going to examine inside of your ears. A little bit uncomfortable, but nothing that you shouldn't be able to sustain. Okay. All right. I'm going to pull the ear up and back, and I'm going to insert the otoscope inside, and the tympanic membrane is pearly gray, and the cone of light is at 5. We change it. I'm going to pull up and back. Just turn to me, please. Tympanic membrane is also pearly gray, and the cone of light is at 7, and no sign of infection or discharge or anything like that. No impacted cerament also. Okay, so now while we're here, I'm going to ask you to pull the tip of the nose, and I'm going to observe inside. Okay. All right. There is no sign of discharge or wetness in the nose, and the septum is midline. Okay, good. Thank you so much. Okay, now I'm going to continue with the test. I'm going to palpate your sinus. Tell me if you feel any pain or tenderness. Okay? All right. I'm going to palpate your frontal sinus, your maxillary sinus. Do you feel any pain?
Okay.
And I'm going to also palpate the lymph node. I'm going to palpate the pre-auricular, post-auricular, cervical, tonsillar, submandibular, mental, anterior cervical node, okay, posterior cervical node, and here is the sternal notch. Let me turn it a little bit. Sternal notch, and then I'm going to feel also for the trachea, which is midline. You can turn your head, and I can feel the thyroid gland. Later on, I'm going to go toward the back and ask you to swallow. So I'm going to give you your juice. I'm going to ask you to swallow for a minute, and then your water. Hold on, don't swallow yet.
Mm-hmm.
I'm going to ask you when it's time to swallow, okay? All right. Okay. Now you can swallow. All right. Very good. So there are no signs of inflammation or growth of the thyroid gland. Very good. I'll put that for you. Okay. Now, I need to palpate the superior clavicular node and also the inferior clavicular node, which is right here, right up here, and inferior is on top of, superior is on top of the clavicle and inferior is at the bottom. Okay, very good. Now, because I'm here, I'm also going to examine your neck. No sign of inflammation or veins distension in the neck. And because I'm in the neck area, let me also check for cranial nerve number 11, which is the spinal nerve. I'm just going to ask you to shrug against resistance, and I'm going to try to push your head. Just show resistance. Okay, very good. All right, we're getting there. Now, I'm going to examine your mouth, and what I will ask you to do is just to be patient for a minute. I'm just going to clean my hands, put my gloves on because it's a little bit uncomfortable. I'm going to use a tongue depressor. There are no signs of inflammation on the lips and no cracks. I'm going to use the light and I'm going to use the tongue depressor to examine your mouth. Okay. All right. Very good. I'm going to ask you to say ah. I'll do my best. Okay. Can you stick your tongue out? A little bit more. You can do better than that. Okay. And I want you to turn it to the left. Out to the left. Out to the right. Okay. And I want you to go up, down, down. Okay. I'm going to use the tongue depressor. You can open your eyes. Maybe that will make you more comfortable. And I want you to stick your tongue out and say ah.
Ah.
Okay. Gag reflex is present. And the tonsil, they are just moist and pink inside of the mouth too. No sign of any lesion or bleeding, inflammation or gum disease. And the teeth look appropriate for patient age. And the uvula is also midline. And I just want you to open your mouth. I'm just going to stick my finger for a minute. And the hard palate is felt in the front, the soft palate in the back, and the bottom. It's not working good. Okay. All right. Thank you so much. I'm so sorry for all the derangement. Okay. So in doing that, I was able to examine cranial nerve number 9, 10, which is the vagus nerve for the gag reflex, and 12, hypoglossal for the swallow. Okay, so now I wash my hand again. Don't worry. Now, what I will ask you to do, I'm sorry, I hope my hand is not too cold. What I will ask you to do, I'm going to ask you to go like this. And shoe. I'm going to palpate for the TMJ. I want you to go, it's okay, left and right. That is testing the trigeminal cranial nerve number 5, both sensory and motor. Now I'm gonna ask you to close your eyes, and I'm gonna touch your face and tell me if you feel soft, dull, or sharp, and that will be examining the sensory part of cranial nerve number 5. What do you feel?
Soft.
Mm-hmm.
Soft.
Mm-hmm.
Dull. Dull. Sharp. Sharp.
Okay. And I will also be examining cranial nerve number 7, which is facial. What I'm going to ask you to do, I'm going to ask you to smile. I'm going to ask you to frown. Okay. Cranial nerve number 7 is also sensory and motor, and the sensory part would be asking the patient to taste something sweet or something salty, which we're going to omit for this test. Okay? So I'm going to go on with my test now. Okay. Okay. I'm just going to make sure that the camera is working properly. Okay. Now, I'm going to examine the anterior chest. What I will do, I will again inspect. Can I turn the chair a little bit? Okay, that's fine. I'm going to inspect and make sure that there is no mark, no lesion, nothing like that, no scar. And then I'm also going to palpate for any mass, any lesion. And there is none like that. It's very good. And also I will percuss, and I'm supposed to hear resonant sound on the chest, which is actually the right thing to do. Okay, and I will auscultate for the breath sound first, and I will ask the patient to take a nice deep breath, and I'm going to use the diaphragm of the stethoscope to listen to the breath sound. I want you to take a nice deep breath, please. Not too fast. Again. 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 Okay. Now I'm going to use both the diaphragm and the bell of the stethoscope to listen to the heart sound. The breath sounds were no adventitious breath sounds, they were regular breath sounds. Now I'm going to listen to the heart sounds with the bell of the stethoscope and the diaphragm of the stethoscope. It's already here and there. Now, what I will actually do at some point is ask the patient to lean forward when I'm ready to listen to the apex. Okay? Now I'm listening I'm going to use the clavicular bone to check, and I'm going to press to find the second intercostal on the right side, and I'm going to listen to the aortic. Just relax. It's okay. And the pulmonic, second intercostal, right side, left side, I'm sorry, second intercostal, left side. I'm going to listen right here to the herb point, third intercostal, left side. About down here, fourth intercostal for the tricuspid, left side. And mid-clavicular, that's where at the apex of the heart, I'm going to listen for the mitral. And that's where also S1 is best heard by asking patient to lean forward a bit. Now I'm going to use the bell of the stethoscope to do the same. The aortic, second intercostal, right side. The pulmonic, second intercostal, left side. The third point, third intercostal, side. Sorry, tricuspid, fourth intercostal, left side. And again, the right shoulder, mid-clavicular apex, I'm going to ask you to lean forward a little bit. Just relax. Sorry. With the bell of the stethoscope, I was able to hear S1 very loud at the apex, and S2, no heart murmur or extra breath sounds. Okay, so now I'm going to go, you can cover, I'm going to go toward the back, and let me just make sure that the camera can see both of us. Okay, very good. Sorry. Are you okay?
Yes.
Very good. I just want to make sure that the camera can see me. Okay, I'm going to expose your back a little bit. Okay, and again, I will still do the same with the inspection, and the skin look good, is warm to touch, and I will also palpate. And while I'm here, I can slightly observe the spine, no curvature and no mass or anything like that. But in palpating also, I'm going to do tactile phonetics. I'm going to ask the patient to say 99, and I'm going to put my hand to feel the vibration. I want you to repeat 99.
99.
Feel the vibration. I want you to repeat 99 again.
99.
Again.
99.
Okay, now I'm going to use the diaphragm of the stethoscope. I'm going to perform the egophony, and I'm going to ask the patient to say the letter E. Please say E.
E. E. E. E.
And the sound sounds like a N, which is
E. E.
No diminish of that time frame. Now I'm going to do the whisper pectoral, and I'm just going to whisper 99 and also listen while the patient is whispering. Okay? Can you whisper? Okay, very good. Okay, now I'm also going to listen to the breath sounds from the back of the patient. And what I will ask her to do is to relax and take nice deep breath. I want you to take a nice deep breath for me. And on the right side, I'm going to go a little bit. Okay, very good. Now, while I'm in the back of the patient, I'm going to check the chest expansion. By doing that at the level of the lumbar, it's okay, I'm going to turn the bed. I'm just going to put both of my hands, and I'm going to ask the patient to take 9 deep breaths, and I'm going to observe my tongue to see if the breaths are by the chest expansion is equal bilaterally. Okay, I want you to take a 9 deep breath. Okay, and you can see that the fold is forming and expanding equally on both sides. And while I'm here, I'm also going to check for the AP diameter. I'm just going to use the tape to measure from here to there. It's about 16. And then I'm going to measure from this side. Can you lift up your arm a little bit? And it's about 8, which is good because it's supposed to be a 2-to-8 ratio. The patient saw no sign of barrel chest or any kind of deformity. And while I'm here, I'm just going to tap your back and tell me if you feel any tenderness, okay? Any tenderness?
No tenderness.
Okay. That was for severe tenderness, and the patient showed no sign of tenderness. Okay, I'm going to put that down for you. You're going to lay down. You're going to be like halfway there, okay? Just be safe, be careful. Okay, now that my patient is laying down, I'm going to try my best to give her as much privacy as possible and ensure that my video is taking. Okay, very good. And while my patient is laying down, I'm going to take the opportunity to do all the pulses, and I hope everything can be seen here. Let me turn it a little bit. Okay, that will not be the best. Sorry. Okay, so first I'm going to feel for the temporal pulses on both sides. I'm going to feel for the carotid artery one at a time. Just relax. Okay. Brachial bilaterally. Brachial pulses bilaterally. Radial pulses bilaterally. Just relax. Thank you. Okay. Brachial pulses on the other side. Radial pulses. And sorry, I'm just gonna close this. I'm just gonna feel for the femoral pulses bilaterally also. Sorry, I'm just gonna lift this up for a second, okay? Popliteal pulses behind the knee bilaterally. In the interest of time and not messing up my video, I'm just going to let you, let me just move it for a second. Put it toward the back so you can see. That is the dorsalis pedis, and I will follow the great toe and feel it on top of the leg, the foot, sorry, on both sides. And while I'm here also, I'm observing for any sign of edema or uneven air distribution, which there is none on my patient. And I will also check for the posterior tibial. Okay, very good. Okay, all right. You just relax. Now I'm going to use the bell of the stethoscope to listen for any breath. I'm listening to the temporal bilaterally for any breath. Just going to adjust this. Okay. To the cavity for any breath, one at a time. Now, while my patient is here, I will ask her to turn her neck to the left side, and I'm going to observe her jugular vein. Sorry, I just have to note this for a minute. So the bed needs to be supine and the bed of the head needs to be at 30 degrees. And I'm going to observe the right side of the patient to see if there is any jugular vein distension. And the way that I will measure the jugular vein distension is that I will use a ruler, and I will put on the patient's chest, and then I will align the ruler with a flat surface. I'm going to put it on the xiphoid process. I'm going to put it there and measure. In this case, it's only 3 centimeters, which is normal because my patient got no sign of jugular vein distension. So while she's here, I'm also going to listen to the heart sounds with both the bell and the diaphragm of the stethoscope while my patient is laying down. Okay? Are you okay?
Yes.
Very good. I'm going to use the bell of the stethoscope, and I'm going on the second intercostal. I'm going to listen to the aortic valve, artery. Pulmonic. Point. Tricuspid on the fourth intercostal. And the mitral fifth intercostal mid-clavicular line. At this point, I'm going to ask my patient to sit up because that's the best way to listen to the heart sound. And S1 and S2 are heard, no extra murmur. I'm going to use the diaphragm of the stethoscope to listen again. Okay, very good. Just making sure that I see. Okay, very good. Now I'm going to go on and continue with the exam of the abdomen of my patient. I'm just going to try to give her some more privacy. So again, with the abdomen, what we do, inspect for any mark, any lesion, any scar, and there are none like that here. And then after I inspect, I'm going to auscultate, and I'm going to auscultate with the bell of the stethoscope. I'm going to auscultate on the left side, midline, like more toward the left side for the aortic artery, for any breathing or breathe. I'm going to auscultate for the renal artery bilaterally above the umbilicus, the iliac artery below the umbilicus bilaterally, and also the femoral around the groin. Sorry. Bilaterally, and you will note it. Okay. I'm going to use the diaphragm of the stethoscope to listen to vowel sound in all four quadrants. That's kind of a little bit difficult. I probably will not hear any vowel sound. I didn't hear any vowel sounds, but in normal circumstances, I would wait and for 5 minutes until I hear vowel sound. So my next step will be to do percussion, and in doing percussion, I'm going to measure the liver span. Okay, the way I will measure the liver span, I'm going to start around the clavicular bone, and I'm going to do my percussion. I'm hearing resonant sounds, which is normal. And as soon as I hear some dullness, I'm going to mark it. And again, I'm going to go from tympani to the abdomen. And as soon as I hear some dullness, I'm also going to mark it. And it is how I'm going to determine the liver span. And I'm going to mark it here, sorry. And I will use in centimeter to measure the liver span. Okay. It's about 7 centimeter, which is normal for women, and in men it's about 10 centimeter. And also I'm going to go to the right upper quadrant where I'm going to percuss over the spleen. I should hear some dullness. Yeah, I got some dullness right here. And I'm going to percuss all around the abdomen. And I hope you can hear tympani. Yes? Okay, all right. Now, after I'm done with that, I'm going to start with my palpation. I'm going to start with light palpation. Tell me if you feel any tenderness.
No
Any
tenderness.
pain.
No pain.
No pain, no tenderness. Okay. I'm going to do deep palpation. I don't feel any lump, any mass. And my patient is not covering or showing any sign on her face that she's in any pain. So everything is good. Okay, now, very good from this part. Now, what I will do, I will use my right hand to put under my patient, and by pressing, I'm going to attempt to feel for the kidney. I'll go on the other side and do the same. Sorry. Feeling for the kidney. I will also attempt to feel for the spleen, but in order for me to feel the spleen, it would have to be at least 3 to 4 times, 3 times the size in order for me to feel it. Sorry. And in doing the palpation, I could have done something also called the hooking technique, is to check for the liver edge. And what I will do is ask the patient to take a nice deep breath, and then the chest would go up. And in doing this, I would be able to feel for the edges of the liver. You can go down and relax now. Okay, very good. Now, we are done with this part, and we're going to go on with the musculoskeletal. Sorry. What I will do, let me check and make sure my camera can see me. I think I'm going to move the camera down. Okay. I want you to put your leg up. I'm checking for muscle strength and hip. And for the hip range of motion. And I will also check. Okay, I'm going to go like this. And I'm going to check for strength. Okay. Now I'm going to ask you to turn around and sit down. Okay, so what a lot of you left. I want you to extend your hand. That's the pronator drift. There is no shaking. And I'm going to ask you to put your hand down. Close your eyes. Tell me what you feel.
Paper clip.
And here.
Okay.
Okay. Keep your eyes closed. What is that? What do you feel?
Soft.
Okay.
Soft. Dull. Dull. Dull.
Okay. And I'm going to check for, just turn your head, vibration. Do you feel it?
Yes.
Good.
Yes. Yes.
Okay. And now I'm going to check for the tendon reflex, that tricep, bicep, brachial, tricep, bicep, brachial. You can see, very nice. Okay, very good. All right. Now we're almost done. We're almost there. I'm going to ask you to stand.